Today's Focus Report takes us to India. The government there has announced it's allocating just over $1 billion to a Herculean plan to overhaul the healthcare system. Modicare aims to provide health insurance to 500 million of the country's poorest. In a land that has the world's highest disease burden and where there's a chronic shortage of doctors and clinics, these changes can't come soon enough. But is Narendra Modi's plan bold enough to bridge the gap? Our team has been to find out.
This dormitory in New Delhi is a refuge for hundreds of poor and underprivileged patients. They come from across the country and spend months here at a time. 18-year-old Papu Kumar came for a kidney transplant, travelling over 1,000 kilometres from the eastern state of Bihar.
I have 5 different types of medication that I have to take twice a day, and I will have to keep on taking these for the rest of my life. Back where I live, there are no transplant facilities. If undergoing surgery closer to home had been an option, even in state capital Patna, then I wouldn't have had to travel as far as Delhi. Nobody wants to go through all this trouble.
Papu is one of millions of medical migrants who are forced to travel far to be able to access quality and affordable healthcare. Most come to Delhi for treatment at the All India Institute of Medical Sciences, one of the best public hospitals in the country. Papu has to wait with hundreds of other patients twice a week for his post-transplant checkups.
Blood pressure भी देखता है घर पे? कितना रह जाता है?
129 आता है कभी मम्मी बोलता है
lifetime में नहीं. So they can get quality treatment at a very nominal or practically free cost. A lot of patients do require these kind of therapies, and facilities available are still limited. So there would always be patients who would be coming from all over to get a treatment, both for the name as well as for the ease of treatment.
Currently, there just aren't enough public hospitals for everyone, and private facilities are far too expensive. Estimates suggest that around 60 million people are forced into poverty every year due to healthcare costs. Only about 27% of all Indians have any insurance at all. To address this issue, the Indian government wants to provide 100 million of India's poorest families with 6,000 euros worth of health cover. That's 15 times what poor families can currently claim from the government. Just in terms of people covered, this could be the world's largest public healthcare scheme. But experts believe that without strengthening infrastructure and hiring more doctors and nurses, the scheme could fail to take off. At the moment, India has a measly 0.7 doctors per 1,000 people. Alok Saxena is one of the many bureaucrats who will be in charge of implementing this ambitious scheme.
It's a typical chicken and egg situation. So you cannot wait for those capacities to get built and then wait for the scheme to start. So somewhere you have to make a beginning.
Dr. Narottam Puri is medical advisor at Fortis Healthcare, one of India's largest private hospitals.
This is the cath lab. You're seeing a cath procedure being done.
In India, 70% of healthcare delivery is in the hands of private hospitals, but they have been criticized for being hostile to the poor and putting profits first.
This is a service industry. If you are going to invest in a particular company which has put up a private hospital, you as a shareholder will want a return. 25, 30 years ago, majority of the people used to go abroad to get their treatment of getting stenting done or getting bypass surgery done. So look at the benefits that have accrued to the country that all these facilities are now available here. That they are going to cost is inevitable.
But most Indians cannot afford hospitals like these. To make it easier for poorer Indians to access state-of-the-art surgical care, one insurance scheme in Karnataka, a public-private initiative, is leading the way. Hanumantarayappa, a daily wage labourer, felt sudden chest pains at work and was told he needed a double valve surgery.
Undergoing heart surgery in a private hospital would have cost me at least 4,000 euros. I wouldn't have been able to afford that. But thanks to this scheme, I was able to get this surgery, and I'm now able to work again.
Yashashvini is a self-funding scheme for farmers and their families. Individuals contribute €3 a month for catastrophic health coverage.
This is my Yashashvini card. I renew it every year.
Yashashvini was the brainchild of Dr. Devi Shetty, a leading heart surgeon and a vocal advocate for affordable healthcare. He believes the individual pay-in aspect has led to the scheme's success. Since its inception in 2003, there have been 130,000 surgeries done under this plan.
There is no doubt that the NHS of UK or France's government health schemes are the best thing for the people. The question is, where is the money? If you have a very vibrant economy, yes, maybe you can generate, but the economy goes up and down. So with that kind of a scenario, making people to contribute a tiny amount of money every month or every year, that doesn't hurt them.
For the moment, the national scheme will be entirely funded by the government and is estimated to cost around 1.3 billion euros. Implementing this promises to be a gargantuan task. But experts say if done right, this could be a step towards universal healthcare.
Well, that focus report from our team in New Delhi on the Indian government's ambitious healthcare plans can be viewed once again in full on our website. This time